Hello, my name is Shirley, and this is my presentation on stroke. Stroke is a disease that affects the brain. It is the fifth leading cause of death and disability in the United States. The brain consists of blood vessels that supply oxygen and nutrients for it to function properly. When a blood vessel is blocked or it ruptures, that part of the brain can be damaged, which can cause long-term disability or death. Stroke can occur with little to no warning signs. There are two types of major stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common, and it occurs when there is a blockage to the blood vessels in the brain that prevents blood flow and lack of oxygen to the brain cells. It is caused by cerebral thrombosis, which occurs when plaques build up within the blood vessels, and cerebral embolism, which is a blood clots that form in the heart or artery that breaks off into the bloodstreams and travels to the brain's blood vessels, causing a blockage as it's too big to pass through those small vessels. And then hemorrhagic stroke, it occurs when the blood vessels ruptures or leaks blood, causing increased pressure to the brain, leading to brain cells damages. The two type of hemorrhagic stroke are intracerebral hemorrhage, which is bleeding within the brain, and subarachnoid hemorrhage, which is bleeding between the inner and outer layers of tissues that cover the brain. In addition to those two major strokes, there is another type of stroke called transient ischemic attack, which is known as a mini stroke. It occurs when the blood flow to the brain is temporarily blocked, most often less than 5 minutes. The person may experience symptoms lasting for a few minutes and up to an hour, and usually goes away on its own. Experiencing mini stroke is a sign of a possible major stroke in the future. Therefore, do not delay medical treatment and seek help right away, as it can decrease your risk of a major stroke and can make a difference in avoiding lifelong disability. Stroke is a medical emergency. Call 911 right away if you or someone you see is experiencing signs of stroke. The signs and symptoms of stroke are sudden numbness or weakness on one side of the body, such as to the face, arm, and or leg, loss of balance, sudden confusion, not being able to speak or understand what others are saying or know what's going on around them, speech is slurred, sudden loss of vision and trouble seeing in one or both eyes, sudden severe headache that they have never experienced before and with no known cause. Those having strokes may have one or more of these signs and symptoms and may not have all the symptoms. If you have any symptoms that only last for a few minutes and then disappeared, it may be a mini stroke or transient ischemic attack. Most often, people who are experiencing symptoms of major stroke may not be aware that they are having a stroke, or they may not be able to call 911 on their own at that point. When you suspect a stroke, the acronym FAST is important to remember for signs of stroke. It is essential to know and recognize the signs and symptoms of a stroke. Also, it is very important to remember that with stroke, time is brain, which means that the sooner the person gets medical treatment, the better a person's chance of recovery and less damage can occur. Therefore, do not delay and call 911 right away, or if the person is in a healthcare facility, follow the facility's protocol. There were several screening tools that were developed for the general public to help identify a person having an acute stroke. An initial study found that the acronym for FAST has an 88% sensitivity in identifying carotid artery distribution strokes, and with 77% of those without the FAST symptoms having strokes in the vertebral-basilar distribution. The FAST screening tool was commonly used as it was easier to remember and was adopted by the American Heart Association. In recent years, study has found that FAST only identifies 69% to 90% of stroke and missed up to 40% of those with posterior circulation events. A research study conducted at the University of Kentucky Stroke Center found that about 14%, which is 104 of 736 patients, did not present with the FAST symptoms. Those who presented without the FAST symptoms tended to be younger and had less severe neurological impairments based on the NIH-SS score. About 70% of those patients were found to have symptoms of either a gait abnormality or a visual impairment. In addition, the reviews of MRI reports show that 71% of strokes involving the vertebral bibasilar circulation were missed when using the FAST algorithm. For the 14% of patients with stroke who would not have been identified by the FAST algorithm alone, the modification and addition of the letter B and E for balanced eyes were added to the FAST algorithm, and the rates improved with a reduction rate from 14% down to 4.4%. With the befast algorithm, the proportion missed that was limited to the vertebral bibasilar circulation was reduced from 71% to 43%. Also, it could capture over 95% of ischemic stroke. Based on recent research findings, we should consider using the befast algorithm as it's more effective in identifying patient with a stroke compared to FAST algorithm alone. There are a few health conditions that can weaken or thin the wall inside the blood vessels and increase your risk for strokes. These are chronic high blood pressure, cerebral amyloid angiopathy, arteriovenous malformations, sickle cell disease, atherosclerosis, diabetes, heart disease, artery disease. The other risk factors are age, gender, race or ethnicity, personal or family history of stroke, tobacco use, obesity, alcohol and drug abuse. Making healthy lifestyle changes can reduce your risk for stroke. It is important to take charge of your health by seeing your healthcare team and doing annual preventive care. If you have a medical condition, it is important for you to take your medication as prescribed. Maintain a healthy weight by getting regular exercise, such as walking, for about 30 minutes a day. When eating, it's important to choose healthy meals and snacks by eating more fresh fruits and vegetables. Eat less of foods with saturated fat and trans fat, and limit salt intake. There are some risk factors that a person cannot change or control, which are unmodifiable, and it is a person's age, their gender, their race or ethnicity, personal and family history of stroke. However, there are other preventative measures that is modifiable, which a person can change or control to decrease their risk for stroke, which are hypertension, hyperlipidemia, tobacco use, heart disease, diabetes, obesity, alcohol and drug abuse. Stroke is a medical emergency. The treatment plan will vary depending on what type of stroke and how much time has passed since the onset of symptoms. Some of the treatment intervention may include for medicine, TPA, aspirin or clopidogrel, vitamin K if the patient is on anticoagulant. Some of the medical procedure are carotid angioplasty and stenting, aneurysm clipping, coil embolization, drain excessive fluids, and surgery for temporary removal of the skull to relieve cranial pressure. How is life after stroke? As part of the recovery after a stroke rehabilitation may be needed, which includes physical therapy, occupational therapy, and speech therapy to help patient relearn skills needed to function to perform daily activities, and it is individualized based on individuals' deficits. Most patients are left with residual impairment causing long-term disability. Individuals' recovery and progress will vary from one another. Some complications that patient may experience after a stroke are paralysis or weakness to both or one side of the body, numbness and or tingling sensation to extremities, pain in hands and feet due to lack of movements, cognitive impairment to memory, learning, thinking, and attention span, inability to control or express emotion, dysphagia, which is difficulty in swallowing, dysphagia, which is difficulty in speaking, inability to control bowel and bladder. It may be temporary or permanent, depression, and post-stroke fatigue. It can be linked to depression. It is essential to address fatigue early on as it is a major symptom that is often experienced after a stroke and can persist over time. This greatly impacts their ability to perform activities of daily living as they are often exhausted despite getting enough rest. It is important to understand that accomplishing the task requires both mind-body connections to focus mentally and physically. And if either of these is lacking, it will make it hard to complete a simple task. How can healthcare professional help? Stroke recovery is a team effort that involves the patients, family, their caregiver, and interdisciplinary teams to coordinate a care plan. It is important to provide referrals and connect patients, their family, and caregivers to services that provide support groups and other resources available for stroke management. This is the end of this presentation, and thank you so much for listening.